Hello, my name is Jonathan Corsinetti, and today I'm going to be talking to you about erectile dysfunction and its impacts on relationships and quality of life. So first, what is erectile dysfunction? Erectile dysfunction is defined as an impairment of sexual function accompanied with or by psychological distress. It is the inability to have and maintain an erection for an extended period of time. Erectile dysfunction is more common in the community setting. The prevalence can vary from about 10% to 52%. Prevalence in 40 to 80-year-olds can range from about 13 to 21%, while in younger men, erectile dysfunction has been prevalent in about 5.8% of them, which they have said that their dysfunction has only lasted about a month. So some risk factors of erectile dysfunction are things like low quality of life, alcohol dependence, substance abuse, urinary tract disorders, chronic illnesses, and medications that are used by men who are depressed. So there are some mental effects that occur within the male who has the disorder. Men can experience a diminished social and emotional intimacy. They will lose self-confidence, and if they don't already have a poor or lesser quality of life, it can turn for the worst. Men with erectile dysfunction will also ejaculate prematurely. To elaborate on this, they ejaculate prematurely because they have a mental issue going on in their brain. They know that they cannot maintain an erection for a long period of time, so that is why they ejaculate prematurely. So in other words, they expect to lose their erection, and they don't want to risk not finishing at all, so then that's why they will ejaculate prematurely. Erectile dysfunction can have many impacts on relationships between spouses. The relationship with the male's mother at an early age has a psychosocial impact later on in life. So the better the relationship the male has with his mother early on in life, the better erectile function he would have, and the opposite goes for a poor relationship. So that would mean if he had a poor relationship with his mother, he would have poor erectile functioning later on in life. So this relationship has been proven to be a key part in males with less erectile function or erectile dysfunction overall. So women have reported loss of sexual desire, arousal, sexual satisfaction, and self-efficacy. With a male having a sexual dysfunction, it can lead to a more hostile and dissatisfactory relationship. Having this hostile and dissatisfactory relationship will also contribute to impaired penile blood flow and lower testosterone levels because the couple are having less sex. So you can see it is a circular reasoning type of cycle where since the male has erectile dysfunction, the couple's not having sex, and since they're not having sex, the male will have lower testosterone levels and impaired penile blood flow. Family conflict is another thing that occurs when a male has erectile dysfunction. And family conflict is defined as physical and verbal aggression, everyone criticizing one another within the family, displays of anger, and frequent arguments between different people in the family. So it doesn't have to just be between husband and wife, but where they're producing hostility, there can be more hostility between like the children and the parents, or children to children, and so on. And these conflicts in the family will arise from the deteriorated relationship between the husband and wife. The main cause of the deteriorated relationship is because of the male having a sexual dysfunction. And the deterioration of this relationship depends on the degree to which the male has of erectile dysfunction. When the male has a severe form of erectile dysfunction, symptoms associated between the couple are long, hostile, and dissatisfying couple bonding, so the couple aren't bonding properly. Children are affected because when their parents are having problems, the children are more likely to have less attention put on them, and so that parent-child relationship becomes much weaker. Theorists will say that family interaction is what defines the overall family environment, and if there's less interaction, then that family environment is not in good health. Also, the health of each family member can be impacted as well because consistent and persistent arguing aggression between one another, and hostility between everyone causes chronic stress, and chronic stress plays a great role in one's health. So there are many different treatments that can help erectile dysfunction. Starting from a biological point of view, there's things like testosterone therapy, phosphodiesterase type 5 inhibitors, so PDE5Is, and a combination of the two. Testosterone therapy has been shown to help improve erectile function as well as preserve the structure and functional integrity of the corpora cavernosa. Testosterone therapy alone, though, has shown that it does not help treat erectile dysfunction fully. So phosphodiesterase type 5 inhibitor therapy is used to inhibit phosphodiesterase from doing its job. And phosphodiesterase is an enzyme which breaks down cyclic guanosine monophosphate, and cyclic guanosine monophosphate accumulates, and that's what helps cause an erection. So both of these work better together because the phosphodiesterase treatment will stop the inhibitory effects of the enzyme, while the testosterone will help maintain the erectile function. Penile prostheses are also used, and pretty much what they are is they are malleable or inflatable devices, so things such as bendable rods, and they are surgically put into the erection chambers of the penis, and these will help the male then maintain an erection for a longer time. Couples can undergo therapy as well, and this will help them with problems within the relationship. It helps them able to cope better with problems and address these problems, and then overall work on them together and overcome them. And marital therapy is best to be done first before working on a family therapy session, because the main conflict, like I said, is between the husband and wife or spouses. They are the ones primarily dealing with the problem, which then breeds hostility between them and their children. Arguments occur more frequently, and then each family member is fighting with one another, and then it's just a mess of a situation, and no family wants that to happen between them. So family therapy also involves resolving conflicts between each relationship between each family member. So like I said, the relationships between a parent and child arguing occurs, while also child-to-child relationship arguments are occurring. And so arguments are the main target for family therapy, because family members are more prone to fighting due to this increased stress in the home environment. And the main goal is to lower the stress of the family, because stress can deteriorate one's health, like I said earlier. So the public also has a view on people with erectile dysfunction, and people have said that you got to make sure to stay intimate with your partner because you don't want them feeling embarrassed, and you want to be able to support them and love them and know that you're there for them. And from a women's point of view, you have to take care of yourself, but you got to remember you have to support your significant other. And there's also been a story of Ken Robson. He has shared his story of having erectile dysfunction. And Ken Robson, he is a male who underwent cancer, and the treatment of his cancer is what caused him to have erectile dysfunction. He wanted to share a story because he wanted to let people know how important it is that both the partners go through having this dysfunction, even though it is the male who has erectile dysfunction. So Ken quoted, "I know it was difficult for her, but she was totally supportive, and I don't know how I would have coped without her." So this quote just goes to show how important it is to have a spouse that is supportive. They both went to see specialists together, and they went and was able to find what worked for Ken. And what worked for him is a thing called a vacuum pump, and it is placed over the penis, and the air is sucked out, and then the blood is then rushed to the penis, and that's what will cause an erection. And this could have been an embarrassing thing for Ken, but it wasn't, because his wife supported him, and when they were in bed, they kind of made some fun out of it, so it made it a less embarrassing thing. So yet again, this is another reason why support in a relationship is so important. These are my references, and I hope you guys enjoyed. Thanks.